Today we've got a number of updates on the steps that we have been taking following yesterday's positive case in Northland. I want to start by giving an overall summary and then I'll give you the latest information from the Pullman Hotel where we know the case was staying. The Director General is going to provide details on testing and contact tracing and a few more specific details around the case. The case has now been given confirmed status. It was a probable case yesterday. It is now a confirmed case. We know that the person's husband and hairdresser have tested negative, which I outlined this morning. That's a very encouraging development. We can also confirm that the strain of infection is the South African variant, and the source of infection is highly likely to be a fellow returnee during the person's stay at the Pullman Hotel. Again, this is good news because it means we know where the source of infection is and we don't have to divert our scientists and health experts from other COVID-related work in order to identify that source. We know that from the genome sequencing that was completed overnight, and I want to recognise the amazing and the fast work done by our scientists to turn that around so quickly. That is a very quick result for the genome sequencing and it has made a big difference. The two people occupied rooms in close proximity to each other on the same floor of the Pullman Hotel, and I'm advised by officials that they are confident that the infection was a direct one and that there is no other missing link in between those two people. We don't know exactly how the infection took place at this point, and investigations on that are continuing. That includes looking at CCTV footage from the Pullman Hotel to identify when and where they may have come into contact with one another. It will also, the review so far has confirmed what we said yesterday, that the case, the Northland case, has adhered to infection control guidelines in her room and in the exercise space as we have asked her to do. So again, I want to thank her for her diligence. Everything that we have seen so far suggests that she has done all of the right things. It has been decided this morning to delay the release of people who were due to complete their isolation at the Pullman today. There are 46 people who are affected by that decision. That can be managed within our contingency. They will be staying a little bit longer. An update from the Ministry of Health on that can be expected later on this afternoon, including an indication of when they are likely to be released. They will receive an extra test prior to their departure as an added precautionary measure. Of the 253 returnees who have exited the Pullman Hotel within the new infection window, based on the information that we now know, 172 of those had been contacted as of 8 a.m. this morning, and work has been continuing through the morning and it will continue through today to make sure that we are contacting all of those people. We're advising that those guests who exited managed isolation at the Pullman Hotel between the 9th of January and the 24th of January self-isolate immediately. They should contact Healthline to arrange a test and they should remain in self-isolation until they get a negative test result. Of the approximately 220 staff who work at the Pullman Hotel, 114 of those have already been tested this week. The remainder of them will be tested later on this afternoon. I'm advised that those tests will be completed by 4 o'clock. Therefore, we should have the results of those early tomorrow. We already have some of the strongest infection prevention and control measures in place in our isolation and quarantine facilities, amongst the strongest anywhere in the world. And we do monthly audits of those to make sure that we're keeping them up to date and to identify where they can continue to be improved. However, as is normal in a situation like this, an investigation is being carried out urgently to look again at whether there are any further changes that might need to be made. Officials are already getting more information based on the genomic testing, which will help us to determine how the infection occurred, what we can learn from it, and particularly in light of the new variants that we're dealing with around the rest of the world. That will also include looking at whether returnee movement should be restricted towards the end of their stay in managed isolation after they've had their final test and before they have been released. Work has already started, as I indicated this morning, on the installation of new filtration devices to the air conditioning systems in our managed isolation facilities. Before I hand over to Dr. Bloomfield for more information, I do want to reiterate a few key public health messages. While officials are working as fast as they can, there are things that every New Zealander can continue to do to help. Get a test if you are feeling unwell and isolate until you get the result of that. Please do not go to work or out in public if you are feeling unwell. Scan everywhere you go, switch on Bluetooth. I'm advised that there has been a surge in people switching on Bluetooth in the last 24 hours. And wash your hands regularly.